Hello everyone. Today I am going to talk about Flexor Retinaculum. So today I'll be talking about the carpal bones, Flexor Retinaculum, attachments of the Flexor Retinaculum and relations of the Flexor Retinaculum. As you can see in this picture, there are 8 carpal bones in total and 4 carpal bones are arranged in one row. So there are 2 rows, one proximal and one distal. Now the arrangement of carpal bones in the distal row is like scaphoid, lunate, triquetral, pisiform from lateral to medial. In the proximal row, it's trapezium, trapezoid, capitate and hamate from lateral to medial. And also the carpal bones are concave anteriorly. Flexor retinaculum is a band-like structure which arches over the concavity of the carpal bones. So it forms a carpal tunnel through which many structures pass. There are also structures passing above the flexor retinaculum. The flexor retinaculum is attached to the carpal bones on the medial end and the lateral end. So on the medial end it is attached to the pisiform bone and the hook of the hamate, and on the lateral end it is attached to the crest of the trapezium and tubercle of the scaphoid. The flexor retinaculum also has a superficial slip and a deep slip. The superficial slip is present medially and the deep slip is present laterally. Through the medial superficial slip, the ulnar artery and the nerve passes through, and through the lateral deep slip, the tendon of flexor carpi radialis passes through. So, remembering this is easy because the ulnar bone is present medially and the ulnar nerves and vessels should also pass medially. So they are passing through the superficial slip which is present medially. And likewise the radial bone is present laterally. So the tendon for flexor carpi radialis muscle will pass laterally. Moving on to the relations of flexor retinaculum. So, since flexor retinaculum bridges over the anterior concavity of the carpus, it forms a carpal tunnel, and many structures pass through the carpal tunnel, and also many structures pass above the carpal tunnel. So, first let's see about the structures that are passing above the carpal tunnel. As you can see in the diagram, there are thenar muscles and hypothenar muscles which are attached to the flexor retinaculum, and in between them there is the tendon of palmaris longus passing through. The tendon of palmaris longus continues as the deep fascia of the palm, that is nothing but the palmar aponeurosis, and the tendon of the palmaris longus passes superficially to the flexor retinaculum. And also, since the flexor retinaculum has a superficial slip, the ulnar artery and the nerve which pass through the superficial slip also pass above the flexor retinaculum. Then the median nerve and the ulnar nerve give off a palmar cutaneous branch. The palmar cutaneous branch of the median nerve and the ulnar nerve also pass above the flexor retinaculum. Now going to the structures that pass below the flexor retinaculum through the carpal tunnel. The most important structure here is the median nerve. The median nerve passes below the flexor retinaculum, but it gives off a palmar cutaneous branch which passes above the flexor retinaculum. And also the flexor retinaculum has a deep slip. Through the deep slip, the flexor carpi radialis passes through. So the flexor carpi radialis also passes below the flexor retinaculum. And then as you can see in the picture, there is the ulnar bursa and a radial bursa. And the radial bursa surrounds the tendon of the flexor pollicis longus. And the ulnar bursa surrounds the 4 tendons of flexor digitorum superficialis and 4 tendons of flexor digitorum profundus muscle. So I'll summarize the relations once. The structures that are passing above the flexor retinaculum are the tendon of palmaris longus, and then the palmar cutaneous branch of the ulnar nerve and the median nerve, and also ulnar vessels and ulnar nerve through the superficial slip. The structures passing through the carpal tunnel are median nerve, the tendon of flexor carpi radialis through the deep slip, and then the ulnar bursa and the radial bursa, and the radial bursa surrounds the tendon of flexor pollicis longus, and the ulnar bursa surrounds the 4 tendons of flexor digitorum profundus and flexor digitorum superficialis. Thank you for watching this video. Please like, subscribe and comment on it.